Thank you, Mr. President. Thank you and the Court for allowing these items to be moved together, a move that I think will be eminently sensible and will result in a more focused and better debate in the public interest. Mr. President, the continuing inability of the Department of Health and Social Care to remain within its budget is and should be a matter of concern to all those who believe in fiscally responsible government. It will also carry broader concerns for society around the effective delivery of healthcare and raise questions about whether or not the healthcare system is capable of meeting expectations within the funding allocated to it. Last year, I presented to Tynwald a 5-year financial plan detailing the availability of funding for the broad range of public services that government is committed to delivering, against a backdrop of continued need for government to redefine its service delivery to meet, rather than exceed, its income generated predominantly from direct and indirect taxation. In doing so, I made it clear that departments needed to maintain strong cost controls to meet the fiscally sustainable targets that we have set. It cannot, therefore, be seen as acceptable for the Department of Health and Social Care to continually exceed its budgets each year and seek a supplementary vote from Tynwald, and in doing so, jeopardise our targeted plans and possibly lead to restricted funding available for other areas of the public service. It is, of course, not new for the DHSC to overspend, but not at the levels we are currently seeing. £9.9 million in 2016, £11.1 million in 2017, and now £9.5 million in 2018. £30.5 million of deficit funding required in the last 3 years, and that is in addition to the £11 million we gave the department in additional funding in the budget last year. I will provide an update on our financial performance this year as part of my budget speech next month, but I can report today that we are able to cope with the additional expenditure required from within the revenue account without the need to draw on reserves. However, Mr. President, this ability to cope with the requested overspend should not be accepted as a panacea to the underlying challenges lying behind this overspend. We have, I might suggest, reached a critical junction in determining the ongoing future direction of health and social care on our island, but determining the direction is going to need more than just acceptance of the status quo. In a nutshell, the problem is, at present, there is no clear evidence upon which to conclude whether the budget is too low or whether our health and social care services are not appropriately designed and or efficiently delivered. So the extent of the problem is not simply restricted to the short-term requirement to manage within an annual budget, but with an ageing population, changes in technologies, better and more advanced treatments, and increasing service expectations, there are significant long-term implications too. As relating to the funding position in England, as a demonstration to you of the scale of the problems we potentially face, I would like to quote from the Nuffield Trust, the Health Foundation and the King's Fund joint statement from the 8th of November 2017, which said, "We estimate total health spending in England will rise from £123.8 billion in 2017-2018 to £128.4 billion by the end of this Parliament in 2022-23. This is far below what is needed to maintain standards of care and meet rising demand. Based on projections from the Office of Budget Responsibility, we estimate that healthcare spending would need to rise to approximately £153 billion by 2022-23. So on that basis, namely a 23% increase in funding requirements by 2022-23, if that's applied to the costs on the Isle of Man health and social care services, this would equate to approximately an additional £60 million in funding by 2023, which is in far excess of which we are currently allowed for in the 5-year financial plan. So whilst alarming, none of this perhaps is a surprise and has been the subject of debate in this place and elsewhere for a number of years. So asking why this has not been resolved by now is, I think, a legitimate question, and I believe there are two main reasons for this. Firstly, the amount of work and firefighting that is required by the department to deliver the day-to-day services inevitably means that the management attention is focused on sustaining the service delivery and there is little time applied for transformation. This is not just a direct criticism of the management of the DHSC, but a reality that is also present in the United Kingdom, and these concerns have been much publicised of late. Secondly, to reconsider the very way in which health and social care services are delivered and funded, which has not fundamentally changed since the 1940s, could be considered in the too hard to do category, especially from a political perspective, where necessary changes may prove to be unpopular. However, without some form of positive intervention, I am concerned that the current system, at the current level of funding, is becoming unsustainable, and that health and social care services may inevitably deteriorate or require such levels of funding that other areas of government services will also become unduly restricted. It is clear that the demands for extra funding are growing, and I note the increasing public calls of this nature from various senior figures based in or around the NHS in the UK. I also note the calls for the UK government to set out how it will create a sustainable long-term health and care funding settlement for the British people, calls that seem to imply that some form of review, as being proposed today, or Royal Commission, may be in order. The latest British Social Attitude Survey from June 2017 also indicates the growing public awareness and concern, with a reported 92% of those surveyed believing that the NHS is facing a funding problem. And I suspect that a local survey may replicate that result. Although, to temper the debate slightly, I do not believe that at present the Isle of Man DHSC and the delivery of care needs is anywhere near replicating what we have seen in British hospitals this winter. No. Mr. President, I am sure that all members will agree that the maintenance and delivery of an effective and appropriate health and social care system is an absolute requirement for the continued well-being and future of the Isle of Man. Yeah. It is a matter of such importance that we must now take responsibility for its resolution and set in place a series of actions to put the service on a sustainable footing. Waiting for some kind of review in the United Kingdom is not advisable in my view. The Isle of Man has a different set of circumstances, and I do not see why we have to wait for the NHS to offer a multilateral solution. We have the ability and the raison d'etre to offer a unilateral solution for our island home. So what is to be done? Well, as it is abundantly clear, this is no easy task, but essentially the funding issues can be broken into two distinct, albeit related phases. Firstly, the short-term challenges of delivering the service as it is currently configured in the most effective, economic and efficient way. Secondly, the long-term sustainability of provision of a health and social care system that is fit for purpose for the Isle of Man. It is the second element, the long-term funding and design issue, which I believe requires an independent fundamental review and is, of course, the subject of this motion. So what do I mean by an independent fundamental review? By fundamental, I mean re-examining, challenging and reviewing the essential elements of how we deliver the services in the medium to long term. The exact terms of reference of this review would be developed in detail and indeed would take into account any observations from members during this debate, should, of course, the Honourable Court support the motion. But in broad terms, would seek to cover what extent the current funding envelope for the range of DHSC services is realistic, to what extent and how the current funding envelope is likely to change over the next 15 years. How do these changes compare to the current allocated budget? Is the assumption of health services being largely free at the point of use still valid for the future, and what sort of alternative regime might be appropriate for the Isle of Man? Should this principle continue of free delivery, then should the scope of what is free at the point of use be more restricted? For instance, could certain procedures be charged for or made available on a means-tested basis? What alternative models to the current state-provided services exist? And how would the implementation of any other model impact on the sustainability of the quality of the services provided by the DHSC? What funding models could ensure financial stability and sustainability, i.e. those that would meet the future funding model without compromising the quality of care being delivered? What financial system would help determine where money might be best spent? For example, should the island move towards a formal commissioner provider model or other delegated financial management systems? What is the scope for changes to current funding streams and co-payment methods? For example, a hypothecated health tax, increases to national insurance, lifestyle taxes, etc. What services need to be delivered on the island, and can technological advances be used to streamline the cost of services and improve healthcare? Whilst such a review may take into account work recently undertaken in the UK, it is, of course, of paramount importance that the outcome from the review provides a platform for the delivery of a system that is right for the Isle of Man, and in that respect it is important, in my view, that the review is chaired independently. As members will be acutely aware, consideration of these matters is highly complex, emotive and wide-ranging. The task of consolidating, assessing and reporting on the findings of such a review in a manner that will enable the various policy options to be clearly articulated, debated as appropriate and then implemented would be and will be no easy task. In my opinion, it will require the appointment of a well-respected, impartial individual with sufficient gravitas and intellectual capability to allow meaningful engagement with the various stakeholder groups. I expect that such an individual will come from off island. I believe that such an individual would also be most likely supported by a panel of relevant expertise needed to support and advise both on data and options, and I expect that an element of this provision could be met using on-island expertise. The review will need to be extensive, will take in the region of 12 months, and will require funding. I do not believe this will be a cheap exercise, Mr. President. Honourable members should recognise that while understandably I am unable at this point to provide a full quote, this could be expensive. However, we should regard this as an investment which we must be prepared to make to ensure that we are able to deliver sustainable health and care systems for the Isle of Man for future generations. It will also provide us with an evidence base that will inform future policy direction, and as recent experience with the review of the MUA's long-term financial plan has shown, a well-researched and informed report can be invaluable in informing debate and policy choices. Whether this motion gains support today or not, the need to address the short and long-term funding problems for health and social care will remain and will require resolution. A recent report from the House of Lords Select Committee on the long-term sustainability of the NHS and adult social care concluded that a culture of short-termism prevails in the NHS and that everyone involved in the system seems to be absorbed by the day-to-day struggles, leaving the future to take care of itself. We need to recognise two things today. Firstly, the department needs to focus squarely on addressing the short-term 3 to 5 year funding issues and take action to manage the department such that it can operate within its budgets. This will require all of management's focus and attention. Secondly, the extent of the matters that need to be considered when reviewing the medium to long term, the 5 to 10 year structures and funding requirements are such that a high quality, focused resource is required that will not be distracted by the day-to-day management or short-term matters that are dealt with within the department and executive. So, a fundamental review would be commissioned by the Council of Ministers and would then be subject to debate in Tynwald. Some may undoubtedly argue this should be led by the DHSC, but for the reasons I have already set out, I believe that this sits better with the Council of Ministers working in conjunction with the DHSC. This will allow, as I've already said, the DHSC to focus on the immediate funding issues, which, of course, is of concern to us all. I want to conclude my opening remarks by mentioning the very recently published Public Accounts Committee report into the Nobles Hospital overspend. First of all, I hope that honourable members will recognise that this report was only published last Saturday and it is unrealistic to expect government to formally respond. But I have had the opportunity to digest the conclusions and read relevant paragraphs. I am sure that the conclusions and the recommendations carry merit, but I also feel that many of these conclusions and recommendations were matters for the management and the new minister to digest and to take on board or reject. My initial view was that Tynwald is going to be in danger of trying to run the department, and more pressure being applied in that respect is not necessarily going to help matters. Political micromanagement is not the answer here. Interestingly enough, though, the PAC have hit the nail on the head, I think, in paragraph 129 of their report, the first paragraph of their concluding remarks. They say, "We set out to explore why there is a consistent overspend at Nobles Hospital, and the true answer to that question is to be nobody knows whether the hospital is spending more than it should, because nobody knows what services it should be providing and at what cost." Exactly my point, Mr. President. Exactly my point. I beg to move.